I drifted into physiotherapy because I didn't know what to do. At 18, do you really know what you want to do? But Dad was a physiotherapist, the first male therapist in New Zealand. Massage and medical electricity. He went into physiotherapy because from war injuries, First World War, he believed he was going blind. He was told he would go blind. And the School of Massage and Medical Electricity, as you well know, is very good for people who are difficult of sight. We have a number in this country, and many were trained in England. So Dad went into physiotherapy. He didn't go blind, but that's how it happened. I was in high school and wondering what to do, and Dad lived well respected in the community, well respected by physicians. They didn't give him prescriptions. They sent him cases with a loose diagnosis, and he did his best with what he had available those days. So I drifted into it. But I had an incident, I should say, in the gymnasium within about 3 months of being in the school, maybe the 4th, 5th month, where I'd been given a set of exercises to instruct patients in. And one patient lying on his back couldn't get his right leg over his left leg. And so I went up and did what was natural to a young athletic person. I gave it a push. And his back cracked, and you could hear it on the wooden gymnasium floor. And I was disciplined in front of my patients. That was on a Friday. Monday he didn't show to the class, but he did show 15 minutes later. And he came in walking very quickly and briskly, shook my hand and thanked me for fixing his back. And clearly, therefore, there'd been an association between my pushing him, the crack in his back, and him now feeling a lot better. So I enthusiastically told my instructor, and I was disciplined again. So this time I went and told my father about it. And he just listened to me and then took me into his office, the room, as you call them in New Zealand, at the front of the house. That's where he had his practice. And he showed me his books of Cyriax and Meynell that he'd collected, but he had not implemented because no one was there to help him with it. Although Gwen Hislop, who was our instructor in massage and therapeutic exercise at the New Zealand School of Physiotherapy, had worked with James Meynell Sr. at St Thomas's Hospital in London during the war years. And Meynell Sr. was the most well-known medical manipulator in the world. Not just in the United Kingdom, but he was often a speaker in America in days that people didn't travel intercontinentally quite so much. And he ran the department at St Thomas's, and he saw the spine as consisting of muscles and ligaments and sacroiliac and facet joints and movement and disc. When Cyriax came and took over from Meynell, he threw out all Meynell's work, and everything became the disc, which was part of the dynasty of the disc anyhow, since Mixer and Barr did the first disc surgery in 1933. Well, Gwen Hislop had trained under Meynell, but it wasn't in our curriculum in Dunedin, and she didn't instruct much of it at all. But she instructed a little bit on the hands sometimes with manipulation. But there was nothing else. During my first year as a student, I believe, Jennifer Hickling had visited New Zealand. She was Cyriax's chief assistant physio at St Thomas's. And Dad had attended that, but that was very different than the books he had by Meynell. So when I showed my father this interest, he said, look, he said, if you want to get interested in manual therapy, we spoke manipulation those days, that was the only term we used, I'll support you. He said, and largely because just a few weeks ago I'd been treating for a couple of months a good friend of mine, my best friend, who had back pain, and Dad couldn't help this person. And the person went to a chiropractor, and 2 or 3 visits later was free of pain. This was a personal embarrassment and a professional embarrassment to my father. Yet he knew something was in manipulation. Didn't believe in the chiropractic theory of being able to treat all disease by it. But just because the theory is wrong, we shouldn't frown on successful practices. Many people have said, practice what is good in the practice of others. Learn to imitate their successes. Don't let their theories get in the way, because many of their successes are our failures. And so I took that to heart and started studying manual therapy and this work. And probably for the next year and a half while I was in physiotherapy school, I studied spine anatomy, spine mechanics, manipulation, just as much as I studied the rest of the curriculum. So on graduation, I was allowed to open a specialty spine back pain clinic at the School of Physiotherapy. That's all I did in the mornings. Worked with my father in the afternoons in his practice. In the mornings, I just treated backs. They needed a therapist. That was my condition. That's what we set up. I treated the chairman of the hospital board. successfully with a Syriac-type maneuver, relieving his sciatica, which I, of course, in those days believed was from the disc. Who knows where it came from? I would examine a patient very differently today. But anyhow, I greatly relieved a problem he had had for over a year. And he said he didn't know how to show his gratitude to me. And I said, well, I have an idea for you, sir. And I just finished reading a book by Winston Churchill, and it was called My Younger Years. And he was 25 years of age when he wrote the book. And in that book, there was a piece of advice which I love to pass on to younger people. Never hesitate to ask a favor of an older person who's in a position to grant you it. Because older people in strong positions often lament that they have all this power, but no one's asking for it. So when I went to Dr. John Fulton, chairman of the Otago Hospital Board, who I treated, and said, sir, well, there is something you can do. I'd like a scholarship to go study in Europe and in America. He said, I don't know if we can do that. And I said, I don't care if it's worth only $1, sir, or £1. I need the letters of introduction. I am, after all, only 21 years of age. No one will take me seriously. But if I can send a letter of introduction on good stationery ahead of myself, I might get through that door. And I won't let anybody down. And that's what Churchill said. When people open that door for you, don't let them down, because that will get around very quickly and all doors will close to you. But never hesitate to ask. Just don't let down your sponsors. So that's how I got the scholarship, and which was, I think, about, I'm going to say £500, $1,000, and that's not much for 2 years, even back then. But that opened the doors, and I arranged everything in advance by writing to the likes of Syriacs and Stoddard. I didn't know of Kaltenborn until I got to London. It was at a Syriacs course that there was a young lady there from Norway who told me about her boss, and it impressed me greatly, because Kaltenborn was 15 years older than me, and 15 years previously he was beating the same path that I was, visiting everybody that had written anything on spine in Europe and in United Kingdom. I did Europe, United Kingdom, and of course America as well, although there wasn't much to learn in America at that time, certainly not from physiotherapy. So I went over to meet Kaltenborn, and he was a long way ahead of me in his thinking, certainly. And I'll never forget his first words to me. He's a taller man than me. He's about 6'2", and I'm about 5'10", 5'11". And he's standing on 2 steps higher than me. He looks down, and he shakes my hand, and then he doesn't let my hand go. Instead, he turns it over and looks at it. He wants to see what my hand's like. He says, yeah, it is a good hand. And then we got inside, and he said, you have been where? And I said, well, I've been studying under Stoddard and Syriacs. I've taken their courses or worked in their clinics, and Stoddard treated his patients, and sometimes treated patients at St. Thomas's. And I'd been to Paris with Jean-Thierry Migue, who was a partner of Robert Maine. They were quite well known in the French and European circles, and I studied with them. And I'd visited a couple of osteopaths and a chiropractor. And he said to me, you must be very confused. And I said, well, yes, I think I am a little confused. They don't agree with one another. He said, yeah, that is true. He said, well, from now on, no confusion. You do it my way. So to this big Norwegian, I says, yes, sir, I'll do it your way. And actually, that was the best advice, because there comes a point in learning that there are so many different views out there. I mean, we're an art in search of a science. We may never complete the science behind physiotherapy, but there are so many different ways of doing it. I mean, in this country, Mulligan and McKenzie, and may I add myself, do things quite differently, although there's some things of similarity. Many key points are different. So anyhow, Kaltenborn said, no confusion, do it my way, and I adopted his way, right down to everything I could. And from that basis, then I would add to his way, because I didn't turn my back on everything else I'd learned. It's very immature for someone to do something one way, then they take a course one weekend and totally change everything they've done, and all the good lessons they learned and all the successes they had before, they turn their back on it. They've got to bring that together as an amalgam, a synthesis. And some people can't do that. They're either McKenzie or they're Maitland. They can't see the virtues in doing both. Or they're Mulligan. Now Mulligan, of course, does McKenzie and does Maitland, but when he teaches, he mainly teaches what he adds to the to the pot. That's not the way he necessarily practices. And so you've got to bring all this together. But for a time, I chose Carlton Vaughan as my base, and I think that was the wisest decision I made. A very fine practitioner and a very good friend of mine still. Has back problems himself today with spine stenosis. Saw him just a few months ago, and he will be at my school later this year in August when we open our new building, a $14 million expansion to our current campus. So I maintain good terms with him.